Guess who the biggest healthcare provider in Nigeria is? You are wrong if you think it's the government. Also wrong if you think it's the private hospitals because it is actually your own pocket. Yes. According to the World Bank, a staggering 70% of all healthcare spending in Nigeria comes directly from the citizens' out-of-pocket payments, which means that Nigeria runs a system where the primary safety net is an individual's personal savings. And you all know that if you go to the hospital, you pay from your own pockets, right? Hi, my name is Olufolake, and welcome to day 25 of 30 Days of Policy, a series where I help you make sense of policy. Today, we're going to be analyzing Nigeria's healthcare ecosystem. Let's get cracking. That 70% out of pocket problem, the government is trying to fix it, and that's their grand vision. But for us to understand the situation, we need to look at that vision and then examine the deep cracks in its foundation because it's actually really huge. So the current administration has appointed a coordinating minister of health and social welfare, Professor Ali Pate, which signals their desire to integrate health into our overall national welfare. And so far, his administration has laid out a 4 point agenda, which is improve health governance, improve population health outcomes, unlock the healthcare value chain, and lastly, provide health security for all Nigerians. And this vision is anchored by the National Health Insurance Authority NHIA Act of 2022. And that act promises to move Nigerians from out-of-pocket payment to a out-of-pool payment by making health insurance mandatory for all citizens, which means that all citizens must get health insurance. However, this agenda is facing three systemic crises. The first crisis is the funding crisis. The root of all other problems is that funding crisis because in 2001, Nigeria and other African leaders signed the Abuja Declaration where they pledged to spend at least 15% of their annual budget on health. And for the last 2 decades, our federal budget has consistently allocated between 4 to 6% of national budget to health. And this means that we are fundamentally underfunding the system. The second crisis is the JACA crisis and is a result of the chronic underfunding of the healthcare system, right? The World Health Organization recommends one doctor for every 600 citizens. However, in Nigeria, we are struggling with about one doctor for every 10,000 citizens. Imagine 10,000 citizens gathering and it's just one doctor that needs to attend to them. It's wild, right? And you really cannot blame our doctors and nurses for leaving the system behind because they're not just going after the money, they are leaving a broken system behind. And guess what? The UK's General Medical Council data shows that over 5,600 Nigerian doctors have migrated there between 2015 and 2023. The third crisis is the federal state disconnect crisis. See, health is on the concurrent list, which means that both federal and state governments are responsible. While the NHIA Act of 2022 is federal, reality of executing this is a patchwork. Many primary healthcare centers, that is the clinics that is close to the people, they are managed by local governments, often with poor results. Now, the government's main tool to fix this is the Basic Healthcare Provision Fund, BHCPF, which is supposed to send federal money directly to these local clinics. However, even this has faced major challenges with disbursement and transparency, proving just how deep the fragmentation really is. So, the new 4 point agenda is a well thought out plan. I will agree with that. But it's like we are trying to build a skyscraper on a foundation of sand. Does that make sense? No. So, because without addressing the fundamental funding failure of the Abuja Declaration of 2001, and without fixing the deep fragmentation between federal, state, and local governance, even the best new ideas will struggle because you cannot govern a health sector effectively if you're unwilling to properly fund it. Anyway, the 2026 national budget will soon be out. Let's see how much the government is going to allocate to it. See you next time.